Here with Dr. Pasha, who has just given his presentation. I just have a few questions for you.
Yes.
The first was, if you could just briefly tell us some of the common concerns of men who are first diagnosed with prostate cancer.
Yes. A lot of anxiety. Because most of the people don't have a lot of information about prostate cancer specifically, but they do have a lot of information about cancer per se. So one of the things is that when they come into my clinics, they are like, am I going to die? Just because they have a diagnosis of cancer. And that is just not the case with prostate cancer specifically. It's a very, very indolent disease where it does not really translate into having a high mortality rate. It's something that they learn during the process, and as they learn more, they understand how common it is in a certain age group, and mostly our elderly population, and that once they come to know of the available options for the management, then they are at ease. But that takes a lot of help, not from a lot of paramedical staff, nursing staff, social services. At that time, they are getting the education after their diagnosis. So the main concern of them is mostly just cancer, and they don't know much about it except that cancer is bad.
Okay. And so a person who would go through radiation treatment, what would they typically experience? What would they feel?
Yeah, this is actually pretty much similar to the fact that they really don't know what they are going to be getting. They don't know what they are going to be expecting.
Right.
They do keep surgery in mind, and they know going to an operating room can cause a lot of complications during the surgery or after the surgery, and what their state would be after the particular surgical procedure. That's the same anxiety that they have with radiation, that what is going to happen once I'm in a room all by myself and the radiation is going through my body. Am I going to become start growing wings, start glowing in the dark, start flying like Superman? No, radiation really does not do any of that. But we sit down and we try to explain to them that radiation is a process which is very specific to the site that we are treating, and especially from the fact that this does not involve cutting, bleeding, anesthesia, or a prolonged recovery which people usually require from surgery. None of that is with radiation. Everybody's had x-rays at some point in their lives. It's pretty much a similar way of going through the process.
Okay.
So once they get educated as to how simple and easy this is, they become very comfortable within the first week of their treatment. And no matter how long a duration of treatment it is with radiation, they have more knowledge than any of the physicians or any of the medical staff because of the experience that they go through.
Interesting. Okay. And are there cancers that respond quicker or better to radiation than others?
Yes, there are certain types of cancers that are very sensitive to radiation.
Okay.
That when you give radiation on the first day itself, the response is usually seen. Unfortunately, prostate cancer in particular is not that type.
Okay.
But we do manage to take a control of the disease in the few weeks of treatment.
Okay.
So there are different categories of cancer. Most of the cancers, within about a week or 2 weeks of treatment, they start producing the effects and the decreased size of the tumor, the resolution of the tumor, and people are feeling a lot better already.
Really?
Yeah.
Okay. Well, thank you for your time.
Oh, thank you. I appreciate it. My pleasure.
And thanks for coming.
Thank you. Thank you so much.